All righty, let's pull this up. Kaboom. Hey, everybody. Thank you for coming. Better Spaces is a health and happiness solution for today's hybrid workplace. My name is Dr. Paul Kochoa with Par 5 PT here in Randolph, New Jersey on a rainy Tuesday, and I've partnered with them to bring you this easy and educational workday session. So today's session is going to be all about tendons, Tendon Health 101. And it's a very timely one because in the past week, I've had to go through these simple conversations and educational sessions with clients. And everybody wonders why pain lingers. Why does the shoulder, elbow, knee pain, keep coming back even after weeks of rest? Most people will assume that pain means something is torn, damaged, or getting worse. In reality, some of the most common aches and pains involved with irritation of the tendon, and they just haven't simply adapted to the demands that we place on them. So in this session, we'll talk about how tendons work, why certain parts of why certain pains linger longer than expected, and what's the latest evidence says about recovery. All right. So you'll learn that complete rest often isn't the answer, how to tell the difference between soreness and injury, and simple strategies to help keep moving while you're helping your body to heal. All right, so a little bit about me. I got my doctorate from Mercy University in upstate New York, and also have a BS in exercise physiology from Rutgers University. I've been in the PT field for over 25 years, and I'm a board certified orthopedic clinical specialist, certified dry needling specialist, certified movement specialist, certified golf medical professional and golf fitness instructor, and certified CrossFit level 1 coach. So movement is all I'm about, and helping people move better so that they can feel better and then ultimately play better. That's all my jam. All right, so let's pull up the slides here so we can get started. Just double checking that all my windows are good. You can see what I'm seeing, and then we're going to pull this up. Kaboom. All right. So again, because I am a medical professional, I've got to always use my slide here to disclaimer. The stuff that we're going to be talking about today is very useful and helpful information, but it is aimed at a broad population. So if you're dealing with something specific, make sure that you have it thoroughly assessed, get a physical exam from a physical therapist. Now, everywhere in America, you can go to a physical therapist without a prescription from your physician. All right. Most people don't know that. I'm surprised at this time, in the past, I'd say 5 to 7 years, we've been able to do this, maybe even longer, maybe close to a decade now, that you can go to PT without getting a prescription. So don't wait. If you're dealing with something, just pick up the phone, call a PT, your local PT, and schedule something. No need to go to a physician and get a script. All right. Let's get into it. So this is kind of like the cycle that people get stuck into when it comes to tendon pain. They spend this in this cycle for months or even years. Pain develops, they rest it, and then pain goes away. Pain decreases, and then they return to activity, and then all of a sudden, boom, their pain develops again. So it's this big vicious cycle. But let's understand what we're talking about. So this is the structure of a tendon. What is a tendon? So we have to figure out that your tendons are your body's force transmitter. All right. Muscles create force. Tendons transfer that force and tension into the bone to create movement, right? So you're familiar with Achilles tendons, rotator cuff tendons, patella tendons in your knee, and then tricep tendons or lateral epicondyle, lateral elbow extensor tendons in your elbow. So if we look at the structure, this is a muscle, and all the way on the left here is a bone. So let's start at the very smallest unit, this collagen fiber, right? And then we have the microfibrils that turn into fibrils, and they are all bundled together to create a fiber. And that muscle fiber is therefore and bundled even more into what we call fascicle. And then those fascicles are kind of bundled into the bulk of the muscle. So these units of muscle, they get innervated by nerves, and the amount or number of units recruited or turned on dictate how much tension you can create in the muscle. The muscle fibers shorten. and the tendon needs to create that connection between the muscle and the bone. All right. So the muscle creates tension. The tendon transfers that tension into the bone, which creates movement. All right. So a closer look. Tendons are different than muscles. You can see like the tendons all the way over here. Oop, right there. This is a muscle over here. All right. Muscles and tendons adapt differently to stress and load. Muscles have a really good blood supply, right? They have a rich blood supply. They recover relatively quickly because of that blood supply. Now, tendons, this white stuff over here, they have less of a blood supply. They adapt more slowly to load and tension, and they prefer gradual loading. So, because the tendons operate on a slower timeline, that's why regular exercise or stretching doesn't really affect or get you to your goal of having a more durable and less dysfunctional tendon. All right. So why tendons become irritated? You can probably see here that on the left here, you've got this healthy tendon, and then you have an injured tendon, which we generally call a tendinopathy, a disease of the tendon, right? It's usually a capacity problem, right? Where there's not enough load into that tendon, which causes weakening and reduced tolerance. But if you have too much load, we create irritation. So there's sudden spikes, right? So think about like your new workout, or now it's spring or summer and you go and do a lot of yard work. You got to plant that bed of flowers, something new. Or you go on vacation and you're doing a lot of new things all at once. Or you go to a tournament over the weekend, whether it be golf tournament or pickleball tournament or some type of activity, and then you do a lot of playing. And then what else? Home projects. So you think about, the activity level that your body and muscles and tendons are used to. There's a sudden spike. There's overuse, too much load. The tendon simply wasn't prepared for that, and then it gets irritated and sort of like inflamed here. All right. So it's kind of like the weekend warrior problem, right? Where you have very little to no activity during the week. You're working Monday through Friday, and then on the weekend on Saturday, you've got like a 3 to 4 hour golf round. You play a tournament that's 3 hours, and then all of a sudden on Sunday you have pain. So tendons really thrive on regular exposure and consistency. They like consistency, not occasional overload, like increasing in tension. So again, tendons thrive on regular exposure, not occasional overload. So remember that. And then that'll give you insight of why tendons get irritated. So most people think like, oh, I just need to rest it. Let me rest it and it'll feel better. So then we get into that cycle that I showed earlier, right? Rest often always fails if you just rest alone, right? Rest reduces the symptoms, we know that, but it doesn't increase the capacity of that tendon. So when activity resumes, the tendon encounters the same challenge, and then the pain returns. So it's that cycle again, all right? So the main thing is that symptoms will improve faster than the tendon capacity, all right? So symptoms improve faster than capacity. That's why it comes back. You feel great, you're going to do the same thing, and then boom, it hurts again. All right. So, but on the other side, flip side is that pain does not always equal damage. We have to understand what's going on in this tendon and why tendon pain, and what does that mean? So most people believe that, any pain means that the injury is worsening. All right. Oftentimes, pain is just sensitivity to a load, a certain activity, load, pressure, weight, whatever. And this is why, mild discomfort during recovery is sometimes expected. When you're doing something, there's like, all right, I feel like I'm creating some type of discomfort, but we're not exceeding a certain parameter. We'll talk about that in a moment. Pain is information, gives your body information. It's a request for change in your body, but it doesn't always mean that it's a danger. It's not like a red flag, all right? So you think about like a bank account, all right? Your tendon bank account. It's a simple analogy, right? The deposits that you put into this bank account, especially with tendons, are strength training, consistent activity, recovery, like stretching or soft tissue work, like foam rolling, and progressive loading over time. That puts deposits in your tendon bank account. Now the withdrawals, you take withdrawals out by sudden activity spikes, poor recovery, poor diet, poor sleep, long periods of inactivity. So those are the withdrawals. So the pain and dysfunction, tendinopathies happen when the withdrawals exceed the deposits, get into the red. All right. So you already know, like if you're a human, you know what it feels like if you have Achilles tendonitis or, tendinopathy, rotator cuff tendinopathy, tennis elbow, golfer's elbow. Those are pain and irritation on the lateral and medial side of the elbow here where the tendons of the hand and wrist connect to the elbow. And then you have knee tendinopathies, typically in the front part of your knee, right below your kneecap. So it's different locations, but the tissue is the same. It's the same general principles for all tendons. All right. So what helps tendons recover? So one, this is based on the research, progressive loading. All right. We want to be able to load that tendon progressively and create adaptations. All right. Strength training, exercise. We want to strength train. We want to target that muscle and tension. And then we want to modify our activities. We want to decrease the activities or the intensity of the activities that have created the problem in the first place. And then be consistent with all of the above: strength training, activity modification, progressive loading. Just be consistent with that on a daily basis. And then just be patient, all right? Because it does take time. What usually doesn't help is just stretching. I'm just going to stretch this out. Look at me. I'm foam rolling and stretching this, and I'm getting more flexible. That doesn't help. And then complete inactivity, just resting it, elevating it, that doesn't help. And then just treatment, like manual interventions without exercise. Exercise and creating the specific amount of rehabilitative or therapeutic stress on that tendon to make it stronger, that is the key. All right, it's all about this Goldilocks zone, this theory about Earth is in this Goldilocks zone in our universe. It's not too hot, not too close to the sun, and not too far. It's not too cold. All right, got to find the perfect mix. All right, finding that right amount, that Goldilocks zone of load is super key. All right, if we do too little, there's going to be no change. There's no adaptations. We do too much, you got irritation. You just want to be just right. All right, the goal is to find that sweet spot where the tendon is challenged but not overwhelmed. All right, we don't want to exceed the tolerance of that tissue. We want to build it up, not break it down too much. All right, so this comes to my 3 rules. Now, I recently started doing this after a course I took early in the year, and it does make sense because some of these things I've been telling people all the time, that if we do something in physical therapy or you're doing an exercise at home, you've got to adhere to these 3 rules. There's like 3A as well, but we're talking about the 3 basic rules, non-negotiables. All right. Rule number 1, whatever discomfort that you feel during an intervention, whether it be an exercise or manual intervention or drill with therapy, you should never exceed a 5 out of 10 in terms of intensity. All right, where 0 is nothing and 10 is the most extreme amount of pain you've ever felt in your entire life. It should never exceed a 5 out of 10. That's rule number 1. Rule number 2, whatever that discomfort feels like, it should never be sharp or stabby. All right, it might be dull, achy, but never sharp. And number 3, as soon as we stop whatever it is, exercise or manual intervention, that discomfort, that sensation stops as well. It never lingers. So you have to adhere to these 3 rules. And if you do, then that helps you find that Goldilocks zone in terms of how to load a tendon properly. All right, and rebuild that up and make it more durable. Okay, so how long does it take? This is the thing. The honest answer, that muscle changes, like strength, that takes weeks. But tendon changes can take months. Many tendon rehab programs can take 8 to 12 weeks. But it has to be consistent. A lot of times people will bail out because they feel good and they stop doing their homework or stop doing the rehabilitative exercises or drills, and then the pain, the capacity of that tendon hasn't built up. So it isn't bad news in terms of how long it takes, but it just means that improvement is totally possible within that 12-week a 12-week period when you set goals and expectations are realistic. All right. So what can you do this week to help reform your tendons or improve your tendons, right? You want to stay active. You want to avoid these large activity spikes. Be aware that if there's something new that you did, and if you do too much, you might irritate your tendon. And then you want to consistently strength train, very basic foundational movements, right? And monitor soreness trends. A soreness after an activity, if it lasts for maybe 24 to 48 hours and it's dull and achy, it's probably a normal amount of effect. But if it lasts more than 72 hours, that's too long. And then you focus on the capacity. What are things that you can do now that you couldn't do before? Not just focusing on pain. Like, oh, this hurts, I'm not going to do it. Oh, this is uncomfortable, I'm not going to do it. Gradually expose your body to progressive overloading, right? More and more loads over time. Be consistent, all right? And then focus on what you can do and what you can control, all right? But the key thing that I always tell people is that time under tension, when we're doing strength training, we're trying to rehab a tendon, make a tendon stronger, we have to improve the time under tension. And this is where people fail because it's not comfortable, right? They usually want to do an exercise and kind of bail out. And specifically, it is the time under eccentric tension. All right, what does that mean? Let's talk about this. Let's unpack what eccentric tension means. All right, so here's my 2-shot. Let's just double check that you can see that. Good. All right, so real simple. I'm just going to grab a seat here. Now, you see my knee right here. It's a very easy tendon that we can talk about, but the same thing goes for every muscle tendon and tendinopathy. So typically, the knee pain or tendinopathy of the patella tendon happens right in front here, right below the kneecap. So you can see that right there. Now, that tendon is connected. It ends on my shin bone, right? So you can probably feel like this bump on your shin. That's where that tendon ends. It goes up and connects into your patella, your kneecap. That patella acts like a pulley. And then it goes up and turns into the quadriceps tendon, which is part of your quad, right? So the quad goes into the patella, and the patella goes into the patella tendon, which goes into your tibia. All right, so all of this structure, right? We talked about the muscle. Now, if the muscle is exercising, the movement is that it shortens and it pulls, right? So if I create tension in the muscle here, I shorten it up and it straightens my knee, all right? As that muscle shortens, it creates tension, all right? And then it shortens, and then this is what we call a concentric contraction. That muscle is under tension and it is shortening, all right? Now, if I lower the leg, that muscle is performing an eccentric contraction. It is gradually lengthening as it is under tension, right? So you can kind of see it's lowering and it has to open and slide to allow the fibers need to lengthen to get that leg down, all right? So that's the two common contraction types. We have concentric, shortening, and then the eccentric. And then we have what we call isometric, where if I just held it in place, did not move, I still have tension, that is just an isometric where we're holding. That is a third type of muscle contraction. The best one that really addresses and is shown to be effective at rehabbing tendons is the eccentric contraction. And that typically can be very, very uncomfortable to maintain over a long period of time. All right, so now that we know the types of contractions, how do we rehab this tendon? All right, so simply if we think about a functional strengthening exercise similar to just a squat, right? Just come standing and then you go down, either you go to a seat and you stand up. So that's our squat. And that movement involves my quad, my quadricep and my patella tendon. Now, let's talk about technique. All right, we know that the technique of a squat can progress or increase tension on the knee, and some change in technique can reduce it. But essentially, if we do an air squat, I want to keep my hands above my shoulders, keep my feet flat, all right, heels stay down, and if I'm going to turn out, I don't want my feet to turn out more than 15 to 20 degrees, all right? If I turn out like 45, not good, all right? So I'm going to give you a little leeway. If we go 15, 20 degrees of turnout, that's okay, and they're shoulder width apart. Now we're going to put the hands above shoulder height, and then we're going to bring the hips down and back, shifting our weight backwards, and then we're going to lower our body. So this is the eccentric phase of a squat. As you can see, I'm bending the knee, the quadricep tendon, the patella tendon is stretching under tension, and then when I come out, everything shortens and I come out of that position. All right, you can apply this to any exercises and any tendon. So if I want to rehab this tendon, what I would like to do is go through that full range of motion, maybe 3 seconds on the way down, right? So here's this time under tension, good technique. Go to the bottom. Actually, once we get past 90, there's actually less compressive force on the kneecap, FYI. And then come back up 3 seconds. All right. If you can do that, then we can increase the time under tension by going slower, maybe about 6 to 8 seconds on the way down. So if I go into this, and I'm going to repeat this for about 10 repetitions, this is going to target that tendon, and I'm just going to do this really, really slow, trying to stretch that tendon as much as I can under load. And then I can come up quick into that 3-second mark. All right, so that's our simple eccentric introduction. All right. So the same thing goes for like maybe elbow pain, right? Lateral elbow pain, those muscles on the outside of your elbow, let me get closer. They just basically do this, right? They extend the wrist. So this is the eccentric exercise, eccentric portion of the contraction, and this is the concentric portion, raising, shortening, and then lowering, stretching. All right. So we're going to add tension on the way down, right? Trying to get as much tension under load. You could use a weight, you could use your other hand as you lengthen that tendon. And then you can come up and then slowly lower. So there's a lot of different techniques that you can do, but the main focus is trying to work with increasing your time under tension, progressing your load from session to session, and moving slow in that eccentric or lowering phase of the exercise. All righty? All right, so hopefully that helped and made sense. So time under tension, right? So that's really important. Okay. So some key takeaways. Let's talk about what we need to talk about. Remember that tendons adapt slowly. They adapt more slow than muscle tissue. All right. So it takes a longer time because they have less blood supply. And capacity matters. How much can you do? And what type of load can that tendon tolerate? That's what matters in terms of when you have spikes of pain, when you have some tendinopathy, and how do we build up that tendon strength over time. All right. Remember, rest alone that rarely solves the problem, right? You get into that cycle that we talked about. And pain, discomfort doesn't always mean damage, doesn't equal damage. Pain does not equal damage. All right. Also, on the other hand of things, pain can be present in the complete absence of any tissue damage. All right, fun fact. And another key takeaway is consistent loading builds resilience. All right, so remember to treat the causes, not just your symptoms. Okay, so let me pull up this thing, get rid of that, and let's check our chat and see if anybody has any questions. No questions so far. Hopefully everybody got some information out of the class today. I'm going to give it a 30-second countdown, and if there's no questions, I'm going to end things out. All right, what about the Achilles? Okay, so that's a good question. So the question is the Achilles. And again, let's pull up these two shots. Now, the Achilles, it basically does this, right? So the Achilles is down here, right? Your calf. And that Achilles, right, the heel tendon, is a tendon that connects two muscles of your lower leg, your calf, into your heel. And what does it do? It does this. It shortens, and then when it comes like this, when your foot goes like that, that's the stretch, all right? So this is the concentric, shortening, tension, and then this is the eccentric, lengthening, under tension. So simply, if we do it in weight bearing to add resistance, just our body weight, this is the concentric phase, and this is the eccentric phase. Okay, so the concentric and the eccentric. So again, lowering under time, that would be the prescription for that. So if I elevate the front part of my foot a little bit, that gives me a little bit more leeway or range of motion to get to this stretch position, basically where my foot goes like this, right? Because if I just go to the floor, it just goes to 90 degrees. I don't get much of a stretch. We want to create as much tension over as much stretch as possible. So it looks like this. It would be the concentric phase, right? Low, slowly lowering, and then definitely slowly raising, concentric, and then slowly lowering. That would be eccentric. So here I come, lowering my heel down. All right, and then gradually repeating that over and over again, nice and slow, up and then all the way down. And then as you progressively load it, you can go up with the two, but then put all your weight on one leg and then lower slowly with the one and get that stretch at the bottom. And if you want to add weight to that, you can hold on to weights or change positions, get into a more of a lean forward position. There's a lot of different ways to increase the tension to improve that capacity as well. All right, so hopefully that answered your question. All right, great presentation. No, there's another one. So great presentation. Do you also recommend taking collagen supplement? Our health. Okay. Well, yeah, so collagen, the research is mixed, right? There's very little side effects unless you have some type of underlying comorbidity when it comes to collagen. So sure, if you want to take a supplementation, it's not my area of expertise, but there's not many side effects, to taking the collagen supplementation. All right. But definitely collagen is like what tendons are made of. It's like if you're taking the supplement, think about it this way. You're eating the supplement, you're ingesting it. There's a lot of things that are in your body that are made out of collagen. Your hair, nails, skin, right? It's like, all right, does this specific tendon in my ankle get the collagen that I'm eating? All right, well, I don't know. So that's where things are mixed. All right, can you do that on stairs? All right, so I'm assuming the question is, can you do that on stairs? That means the little heel raise that I did. Yes, you can. It's much harder, and it might mess up your arch of your foot, but you can do that on stairs. All right, how do we prevent delayed onset muscle soreness? Is it normal when the recovery takes a week? All right, well, there you go. This is the 3 rules. All right, delayed onset of muscle soreness is 100% normal. All right, when you tax a muscle, because if you're strength training and you are weak and you're asking that muscle to do something that's more than what it's used to, you're creating stress, and stress creates this micro trauma in the muscle fibers. You want to talk about it, say like, oh, I'm tearing those muscle fibers. Sure, you want to describe it like that. But this micro trauma in the muscle, because of the exercise, creates this hormonal and metabolic effect that in the next 24 to 48 hours, your body is stimulated to heal that little micro trauma, which makes the muscle stronger. Okay, so delayed onset of muscular soreness is normal. 24 to 48 hours is a normal. If you overdo it, then yes, it's going to be 72 hours up to a week. You did too much. All right, you got to find a way to recover well after whatever stress you put onto it. The recovery will help reduce your soreness after exercise. Strength increase in strength or changes in your body, like I want a bigger muscle, I want a stronger muscle. All of that happens not during the exercise, but after. All of that happens after. All right, you don't get stronger in the gym, you get stronger after the gym, after your workout. And the other thing too is that initially, if you start an exercise program and you're new to it, the initial strength changes that you see are not musculoskeletal. They don't happen in the muscle structure. It has not changed. It happens initially in that first week or two neuromuscularly. Your brain and nerve and muscle connection is more efficient, and then therefore you feel stronger. It's after about 4 to 6 weeks, that's when the muscle growth and changes happen. All right, hopefully that answers your question. Let's see here. Did that finish that question? The Achilles, delayed onset. All right, and then, oh, you're welcome. Okay, very good. All right, and then any other questions, or else I'll close it up for today. All right, cool. All right, thank you everybody for joining me today and those great questions. You could look for this session and many more on the Better Spaces apps. I don't know if you've ever seen it, but I don't know. I've been doing this for over 2 years now, maybe. I don't even know how long I've been doing this. All my past classes, as well as other instructors, are on the Better Spaces apps. Anyway, I'll be back Tuesday, August 4th, for my next class called the Fitness Myths that keep you stiff, sore, and frustrated. All right, so we're talking about fitness myths. You know, many of the most common fitness beliefs are completely backwards. All right, so we're gonna talk about that next time. You know, do you still stretch more, but you're feeling just as stiff? Are you resting more, but still getting sore? Are you working out harder, but not feeling better? You're not alone. You know, this class, it might be because some of the most common fitness advice that you get is outdated or misunderstood. Like I just mentioned about this muscle strength thing, right? So we'll break down the biggest fitness myths in our next class and the things that keep active adults stuck on cycles of stiffness, soreness, and frustration. All right. Why does no pain, no gain? What is that? That doesn't hold up. Why stretching isn't always the solution? You know, what do we and why more exercise isn't always better? All right. Most importantly, you'll learn what actually drives long-term movement quality, resilience, and recovery. All right. So that is it for me today, and hopefully I will see you August 4th for my next class. All right. Take care and be well. Bye-bye.